in.
Hi, I am Bobby. I'm the imaging manager here at Lake St. Louis. I'm here to talk to you today about MRI safety. The number one thing that we need to remember about the magnet is that it is always on. Even if there's no one in my department, the lights are turned off, it's after hours, none of that stuff really matters. The magnet is always on. This is a very, very powerful magnet. The 3T magnet is 60,000 times stronger than the Earth's gravitational pull. So if you were able to drive a car into zone 4, it would suck the car up into the magnet. So it is a very, very powerful, strong magnet. And everybody needs to realize that it is always, always on. The second thing is that our MRI department is divided up into 4 zones. MRI zone 1 is just outside our hallway, just letting people know that this is where MRI is located at. MRI zone 2 is our waiting room. That's where patients are screened and deemed safe to come into zone 3, which is actually where they would get changed, where we would get an IV started. That is a restricted access for screened MRI patients only and personnel. And then MRI zone 4, that's the dangerous area. That is restricted access. It's by invitation only. It's for our MRI techs, the technologist assistant, and the screened, cleared patient. After that, we have a new screening form that was just updated this year. It includes things like pacemakers, implants. We need make and model of these things. Body piercings. We now learned that magnetic eyelashes can get pulled into the magnet. There's some undergarments that women wear that have metal in the crotch area to absorb odor. Nobody wants to get burned down there. So when you come down to MRI, it is very, very, very important that your screening forms are filled out. They are filled out by nurses or doctors or the patients themselves. My team is very adamant about that for the simple fact that bad things can happen down there when we miss things. So that's why they are very, very adamant about having those screening forms before the patient is brought down to MRI. We print it and we sign it. We give it to the technologist. The technologist looks over it and deems whether the patient is cleared to come into the MRI. This slide over here talks about MRI burns. Another thing that my team is very, very adamant about, especially with inpatients and outpatients alike, more so aggravating for nurses with inpatients, are sizes and weights. MRI burns can happen. MRI works off of radio frequency waves. So anytime there's a closed circuit, meaning your skin touches skin or your skin touches the MRI magnet itself, it creates a closed circuit that can result in MRI burns. We use non-conducting pads, goes in between anywhere that would touch skin to skin or skin to the magnet, so to prevent these things. So we do have a weight limit that we stick with. We do have a girth size that we stick with. None of those things can really be fudged at all, not even 1 pound or 1 inch. When nurses come down, we look at stethoscopes, shears, cell phones, ASCOMs, any of those things that you have around you that you really don't think of. If you were to come into zone 4 for any reason, sometimes we have patients on the table that would need medication or anything like that. Those things have to come off of you. We have to have you screened with a MRI compliance card before that you would be able to enter into zone 4 as well. If you have any questions, our extension is 5407. That goes straight to the MRI department. We have a technologist or a technologist assistant down there during business hours that would be able to answer any of your questions. And that's it.
Awesome.